Hey, welcome to the Healthful Woman Podcast, the fastest growing podcast in women's health. Today's Monday, December 4th, 2023. Before the podcast, I have something to say about Israel, and I do plan to tie it into women's health, which is, of course, the point of this podcast. On last week's podcast, my intro was out of date because in the few days leading up to last week's podcast, some of the hostages being held by Hamas were released back to Israel in exchange for the release of criminals from Israeli prisons. On the one hand, I'm of course very happy that some of the hostages are now back home. On the other hand, it is revolting that people are equating this to a prisoner swap. This is not a prisoner swap. The hostages from Israel were taken by force from their homes by terrorists for doing nothing but living in Israel, whereas the people released from Israeli prisons were criminals who were lawfully charged, tried in a court of law, and convicted of crimes like terrorism, attempted murder, and the like. This was not a trade. It was Israel having no choice but to put their lives at risk again by releasing terrorists just to get their hostages back. These are babies, children, elderly women. It's enough to make you vomit. As a podcast devoted to women's health, where are all the organizations in the U.S. and around the world that are supposedly there to support and defend women's rights? How are they not screaming from the top of their lungs about the crimes against women perpetrated by Hamas? Hamas kidnapped, raped, and murdered innocent women, and it's like nothing happened. Are people so blinded by their hatred of Jews or Israel that they feel it's somehow okay to do this to women if they're living in Israel? It's somehow justified? Is there any other place on earth where this could happen and so many people would simply ignore it or justify it? They should all be ashamed of themselves. These organizations don't truly support women. They only support the women they choose to. It's disgusting. All right, praying for the safe return of the rest of the hostages and the eradication of Hamas. Turning to today's podcast, last week we heard part one of Katie Yin's birth story, which was a difficult story, but an important one. Last week, Katie talked about her first pregnancy, which sadly ended with a term stillbirth of her daughter Ellie. Today, Katie's going to tell the story of her next pregnancy, which happily ended with the birth of baby Kai earlier this year. I'm sure you're going to love it. All right, few reminders. If you're listening on Apple or Spotify, we would really appreciate it if you could rate this podcast, preferably with 5 stars. Please do leave comments on Apple and suggestions. I read all of them. Also, please do email us any questions you might have for our mailbag podcast. You can either email them to hw@healthfulwoman.com, or you can go to our website, www.healthfulwoman.com, and click on the link that says, send us your questions. Also, if you want to pre-order the book Emily Oster and I wrote, The Unexpected, it's coming out in April. We have a link on our website, so please do take a look at that. All right, thank you all for listening. See y'all again on Monday. Welcome to today's episode of Healthful Woman, a podcast designed to explore topics in women's health at all stages of life. I'm your host, Dr. Nathan Fox, an OBGYN and maternal fetal medicine specialist practicing in New York City. At Healthful Woman, I speak with leaders in the field to help you learn more about women's health, pregnancy, and wellness. Katie, welcome back to the podcast. Nice to see you again, although in real time it's been 6 seconds.
Happy to still be here.
Yeah, for our listeners, it's been a week. But you were on the podcast last week where we talked about your birth story of your first pregnancy with Ellie, which was unfortunately a stillbirth. And we spoke at the time, about what that was and what that meant and what you went through. But I wanted to have a separate podcast to talk about your next pregnancy, because that's also a very important story. It's a great story, obviously. I mean, you and I know that, and our listeners will know shortly. But it's just a really important story, again, because what you go through in your next pregnancy is also not easy.
Right.
And I think that this is a chance for you to tell your story, a chance for me to hear your story, and for all our listeners to get some flavor of what someone is going through and what's going through their head in the pregnancy after a very difficult pregnancy. So thank you.
Thank you. You said, I think the first time we met you said your next pregnancy is going to be the hardest thing you've ever done, except what you just did, which was lose our first.
Yeah.
And that definitely proved to be true.
Yeah. I frequently tell people like, it's going to be a disaster.
Yeah. Yeah.
But,
it was good to know. I mean, it was good to be prepared that it was going to be as hard as it was.
Yeah. So when we finished last week we were talking about your birth with Ellie, your recovery, and you were already, right away sort of getting in support groups and trying to hear people's stories. And my recollection is pretty shortly after your birth, you reached out to me. It was like
Yeah.
within a month or two.
Yeah, it was
right?
about a month, I think. Yeah.
Right.
I mean, before I left the hospital, I was already asking, like, can we try again? Are we ever going to be able to do this? How long before we can try again? And there was sort of a lot of open questions about that. So I was really eager to meet with you to hear
Right.
your thoughts on what the prognosis looked like for us.
Okay, so you reached out and we met, and I remember the meeting. So, but if you can let our listeners know, sir, what was your like prep for that, or what were your thoughts about that, sort of planning for the next pregnancy, and how did it go on your end? I mean, we get along great.
Went
so
great on my end. Yeah.
So you can insult me if you wanted to. It's no problem.
No.
I'm cool with that.
I mean, so we had actually had a few meetings, I think, at that point with my OB, with our fertility doctor, because we conceived via IVF and had a few embryos in the freezer. And now we were meeting with you. I sort of had two goals, and one was to see if you could give us any insight on what you thought happened to Ellie, in your opinion, after consulting in our case, if you believed that there was a cause of the stillbirth that we had overlooked, because we never determined a cause. We still haven't, and we never will, I guess, determine what happened to Ellie. And then the second was to understand your recommendations for moving forward with our remaining embryos, whether you thought we had a good chance of having a successful pregnancy in the future, whether there was anything we should be concerned about, or a different medical approach that we should pursue. And I think what was really helpful to both my husband and me was your understanding of what we were experiencing emotionally. And you kind of reflected a lot of that back to us. And that helped us. I don't know. I think it helped us know that you got it, and that you knew the intensity of the emotion we were experiencing as the backdrop to whatever decisions we were about to make medically. So you sort of reflected that this was the loss of a child, that having a new pregnancy and another child wasn't like replacing that child we had just lost, much like, if God forbid you were to lose a brother, you wouldn't say that's okay, I have another brother. It's a horrible thing happened to one child, and hopefully you'll have a good outcome with a second child, but it won't sort of erase the loss that's happened. That was helpful for us to hear. And then you also had some reassuring thoughts about how a future pregnancy could go. I think you described what happened to Ellie as getting hit by a bus, which we carried with us for a while, that it was sort of one of these events that was horrible, that can unfortunately happen to almost anybody, but that isn't necessarily likely to recur in a subsequent pregnancy. So that was comforting to us, although it was hard for me to carry those thoughts through my next pregnancy.
Yeah, I mean, sometimes we find a cause, and sometimes those causes are things that can be addressed in the next pregnancy. And for some people that gives them comfort because there's something to like do. And for other people, it brings them horrible pain because then they say, oh my God, what if we had done that last pregnancy? And it can go both ways. Most of the times we don't find a cause, either because it's not possible to find a cause, like maybe the tests aren't available, or because we just don't understand. And that's what happens a lot. And again, some people find that comforting because probably it's not something that's going to happen again. And other people find that horrifying because maybe there's something lurking. And, it's always horrifying, obviously. Yeah. And so, but I will say that sadly, I've had a lot of these conversations over my career, just the nature of my job. And I would say the amount that I've learned, or that we've advanced medically in the past 15 to 20 years, is like nothing.
Right.
I mean, maybe something, but almost nothing. Whereas what I've learned, and I think what a lot of people have learned over the past 10 to 20 years, emotionally, psychologically, is remarkable. I mean, again, thank God I've never gone through a loss like you have, but I have a much better sense of what that means than I did when I started in my career, just from speaking to people and getting a sense, and hearing people's stories and just listening. Really, it's not It's nothing too complicated. It's really just listening to people. But it's so true. It's just, I always tell people it's going to be a really hard pregnancy.
Yeah.
And that's okay. It's supposed to be a hard pregnancy. Like if it weren't hard, like that would be weird.
Right.
I mean, you lost a child. Like it's horrible. I mean, there's like no way to process that properly. And then sort of, just from my experience, give people heads up, like what are the things that are going to be triggering and what are the things that are going to be, potentially helpful,
You said
just being around the block.
Yeah.
No, I mean, listen, some people, therapy doesn't work for them, but
Sure.
for many people it does,
Yeah.
obviously. And I know you mentioned on last podcast how you guys sort of felt like it was the two of you as a team.
Yeah.
It doesn't always work like that. For some couples, this breaks them apart, an event like this. I mean, many couples get closer because of it, and other couples, they just can't process that in the relationship for whatever reason.
Yeah, I think it can be really hard. And I think there were parts of the pregnancy that were really hard for us as a couple to sort of communicate on. And we kind of opted out of communicating on some of the things that we went through that I'm sure we'll get to as the conversation continues. But I think I was really haunted by the fact that we didn't find a cause of the stillbirth. I felt like I did feel that sense that there was always something lurking, and something that I sort of uncovered in therapy is the tremendous pressure that a pregnant person has in sort of being the only one who can really watch the baby, who can. I felt solely responsible. Like I struggled a lot with the guilt of losing Ellie. What did I miss? What did I not, pick up on? Or could I have flagged something, even if it was sort of clinical? Could I have picked up on a difference that could have saved her? So even though we didn't have a cause, I still sort of wrestled with the what ifs all the time, still do. And then, proceeding to a second pregnancy, it just really felt like, well, it's all on me. I gotta watch this kid, 24 hours a day. And so that was a heavy burden, I think, for me.
Yeah. What was there any hesitation of getting pregnant again?
Yeah. I felt worried that it was irresponsible to try to get pregnant again, that there was something wrong with me that would put all our children in danger. These are the sort of non-medically backed thoughts I think that some people have after going through a stillbirth. And then I was also concerned that I wasn't emotionally ready to do it, which may have been true. But I kind of was also, I couldn't get my mind off it. I was sort of obsessed with it. And I felt like I was living paralyzed in time a little bit. I was supposed to become a mother in 3 days. We lost Ellie 3 days before my scheduled induction. And I came home without a baby. So I just really felt like my life can't move forward until I make this transition I was supposed to make. My life can't move forward until I'm able to bring home a baby, or until I know that I can't.
Mm-hmm.
The limbo was really difficult for me. So I felt like I just got to do this, and I got to do it ASAP, to the point that I was talking to my fertility doctor. He said I could do a transfer about 3 months after my delivery, an embryo transfer. So I was asking him if we could start the medications for the transfer 2 weeks before, so that I could do the actual transfer on the day 3 months after. He was kind of like, no, you need to slow your roll. You can wait an extra 3 months and 2 weeks. It's not a big deal. Like I was very wanting to be aggressive.
Okay. And so ultimately you did get pregnant, obviously. And was the fear and sort of all the emotions, did you find that it hit you right away when you were pregnant, or did it sort of start out pretty low because that's not when you had your issue, and sort of build up?
I think the latter. I think it was, if anything, it sort of muted the excitement about being pregnant again. It was sort of like, okay, great, but we'll see how it goes.
Right.
We were all sort of holding our breath, I think, about how this pregnancy would go. And just unfortunately, in the process of seeking out support, which is so important and has been one of the best things I've been able to do, you hear about everyone's terrible story, all the many, many things that can go wrong during a pregnancy, all the, early losses and second trimester emergencies, and then of course third trimester events like ours. And so you're just kind of the expectation that we were necessarily going to bring home a baby was not really there when we got our positive pregnancy test, but we were hopeful.
Right. And then it wasn't that helpful that we threw you for a loop at what was the first visit in our office?
Yeah. So it was just supposed to be.
Good job, MFM Associates.
It was just supposed to be the pregnancy confirmation. Hello.
Yeah.
Here we are and we're happy to be here. And I think I was 11 weeks. And so I was just doing a heartbeat confirmation scan. And the tech said, well, do you want to just do your NT scan while you're here? And I was like, oh, good. Get another anxiety off my back. Let's do it. Let's do it all while we're here. And the next thing I know, Dr. Fox is rushing into the room and asking to take another look at the scan, which is never what you want to see.
You never want to see me. That's bad news. Yeah. But yeah, that was a little bit of a scare. Yeah. I mean, again, we all knew the situation, on the ground, so to speak, and that this was kind of baseline, not your typical level of anxiety.
Yeah.
And so coming in with anything is not going to be received well.
Right. So,
so to speak.
The news that our NT scan was, I guess, abnormal or elevated.
Yeah. Not definitively bad, but just like we need to investigate further.
Yeah. And my husband, unfortunately was running late for the scan. So he wasn't even there. And then he had this spooky sense that if he misses a scan, we get horrible news. So he felt, that was his share of the guilt, I think, of what was going to happen. So you sat us down and talked to us about the realities that we were facing, which were hard because it's, like you said, uncertain. It's
right.
We could be looking at a serious issue with the pregnancy. We could be looking at a minor issue with the pregnancy or no issue, hopefully. But the chances of an issue seemed to be great or at least significant. And I remember the question that was most on my mind is, am I going to come for another scan and find that there's not a heartbeat again in another pregnancy after what we've just been through? And like your very quick response was like, unfortunately, there's a high chance of that in the next couple of months. And that was really difficult for me to sit with and for my husband too.
Yeah. Yeah. It's hard. What are you going to say?
Yeah, it was terrible. And, the thing with a pregnancy after stillbirth is like, I feel like a lot of people's experiences is that it gets harder as you go, but this early part of the pregnancy is kind of chill.
Yeah.
And that
it normally would be.
Right. So that happened to not be the case for us. And I was really, really worried each week. I think I started coming in for weekly scans because I was so anxious that we were going to have a loss. Yeah.
No, I remember that day and the tech coming in and telling me that, one of the patients has a thick nuchal. And I was like, not happy about it. Obviously, I'm like, oh, okay. And then I pull up the images. And I'm like, Katie? I was like, oh, and I was like, oh crap. I was like, oh my God. I was like, this is not, I can't believe this poor thing. I was like, oh my God.
We felt the same way. We were just like, are we the unluckiest people or is there something wrong with, I was genuinely concerned. Is it something with our embryos? Is it something with me? What's happening?
Yeah. But the testing was all normal.
Yeah.
Thank God everything went okay.
So we did a quick CVS and it took, a month to get full results back and then an anatomy scan to prove there weren't any other defects. And that was it was a torturous month or so, 6 weeks.
Yeah. And then we were already planning at some point around that time, meaning it takes weeks to months to sort of, you never know 100% that everything's going to be okay with that nuchal situation, but mostly, but it takes a while to get that because you have to do the CVS, do the anatomy, the echocardiogram. So you're 20 weeks till you sort of can feel that it's predominantly behind you.
Right.
But that was sort of the time we were going to start picking up visits anyways for you.
Right.
So we got to see a lot of you.
Yeah. Yeah. I don't even know how many visits I had. It felt like I was living here practically.
It was a lot. I was at an event recently. It was a bat mitzvah and the mother got up and said, my grandmother is here and she just had, and it's amazing that she's here and she just had a birthday and I don't want to tell you how old she is, but it's 3 digits. So I feel like I counted how many visits you had and I don't want to say how many it was. I know it's 3 digits, but we're getting there.
Yeah. That it wouldn't surprise me.
Right.
It was a lot.
But you guys are remarkably pleasant, so it's it was all good.
We tried. I didn't feel so pleasant the whole time, but
no, you weren't unpleasant. You were worried. You were anxious. You were worried. You weren't you didn't lash out or anything like that. And even if you did, that's okay. Like you can, however you process it, you process it. But you guys were just understandably worried.
Yeah.
And, looking for whatever reassurance you can get. And that's why we're here. I'm sure I told you, like, we're here every day,
Right.
whatever, just,
No, and we felt really supported. And I think that was the best. Well, obviously the superior medical care was the best part of seeing you guys,
we just watched basically.
Yeah.
I don't think we actually did anything.
Well, I don't know.
We did a CVS, but otherwise,
right.
it's support, and it's mostly psychology.
Yeah, and
visits, talks.
That's the big. I don't know. I mean, it would have been really hard for me to get to the end if I didn't feel sort of supported and being able to ask for help. I think when I needed it.
Yeah, I get it. So, what during the pregnancy, other than coming for visits, were you doing for support? On the outside, so to speak.
Yeah, I was in therapy. I mean, therapy was helpful for me.
Mm-hmm.
And I was in, now I'm doing trauma therapy. At the time, it was really just white knuckle. It survived the pregnancy. What are you dealing with on a day-to-day basis? And how can we make those symptoms better? After about, I think, 24-ish weeks, it meant medication. So I contacted you and said, I'm really, I sort of hit a little bit of a not unexpected crisis point around fetal movement time. When kick counts kind of can become a thing, I really started to lose my mind. I don't even know if I shared this with you at the time. There was a point in the pregnancy when I didn't feel like I could sleep lying down. I didn't feel like I could lie down at all. So I slept kind of propped up, sitting, 90 degrees with pillows, because that was the way I could feel the baby the best.
I don't think you told me that. I was actually literally just about to ask you. My next question was going to be, were you able to sleep at night?
Yeah, no.
Yeah.
The answer is no.
Yeah.
I have slept infinitely more since having the baby
and the
having
only one.
a newborn. Yeah, exactly. It's been a relief. So, yeah, I think I didn't get more than a 2-hour stretch of sleep continuously since hitting that 24-week mark. So there was obviously, when you're not sleeping at all, there's a time when you just start to break down. So I had to let my work know. I also, by the way, I think I was on my 3rd day of work at a new job when I found out I was pregnant, that my transfer had been successful. So in the midst of all this, I'm in a new job with new bosses who are luckily extremely understanding. I had to reach out to them and say, look, my pregnancy is going okay, but I'm having a real mental health sort of moment, and, I need some time to work on this. And they sort of said, whatever you need. I took a day off. I reached out to you. I said, how do we feel about medication? I think you had mentioned it early on that it could be a possibility. So I connected with a perinatal psychiatrist and went on Zoloft. And I think that was helpful in kind of taking the edge off gradually, because,
Yeah. It takes some time.
It takes some time. Yeah. And just feeling that I had the support and knowing that there were things that we could do to help the anxiety, knowing that really nothing would take it away until we delivered a healthy baby.
What about family and friends?
I was just talking to somebody about this. I really kind of withdrew in a major way. I think I didn't even tell, if I wasn't seeing people regularly, I stopped seeing them when I was pregnant, and I didn't tell anybody that I was pregnant until after Kai was born. So my coworkers knew, so they became actually unusual lifelines, more than I think one would normally lean on coworkers, especially in a new job. They became a major support system for me. So forever grateful to them. And my family knew about the pregnancy, but I had a really hard time talking about it. And at the sort of pressure, I felt a irrational sense after losing Ellie that I had let a lot of people down who were really excited about this baby.
Wow.
That was my feeling of guilt. Obviously, it wasn't my fault. I didn't let anyone down. This horrible event happened to everybody. But sort of carrying that through to the next pregnancy, I felt a lot of pressure that no one was putting on me to get her here, to get Kai here safely, to get him here safely. And I think it was hard for me to feel people's excitement, to feel people's optimism and hope that I didn't necessarily share, because I was struggling to admit that this pregnancy could go well. And so I wasn't able to talk about it that much.
Yeah. And as you said, you sort of felt that this is all on you.
Right.
That this is whether this works or not is somehow under your control.
Right. Which is flawed, but
it's natural.
Yeah.
I mean, it's not, these aren't, I mean, it's not that they're irrational thoughts, but they're not meant to be rational. It's emotional,
Right.
right? It's just what you feel. It's like guilt, right? Like rationally, you have nothing to be guilty about, of course, but you're going to feel guilty because you feel guilty. Like it's an emotion. It's like, it's like sadness. You feel it. You don't choose to feel it. You just feel it.
Exactly.
And it's the same way. Yeah. So, okay. So the medication took the edge off a little bit. Were you doing like talk therapy as well?
Talk therapy as well. And so it's cognitive behavioral therapy. So it was a lot of, it's not like, psychoanalysis where we talk about your family and, where we know where my pain is coming from.
Yeah.
We were sort of dealing with strategies, breathing exercises, things like that. When I had a panic attack, which happened in the middle of the night frequently, I would get an ice pack and put it on my face and just sort of quickly calm my nervous system down a little bit. I don't think that's medical. Quickly relax my body a little
medical.
bit. Yeah.
If it works, it's medical.
Okay.
Yeah.
So it was strategies like that to try to, any period of lower fetal movement was likely to trigger like panic symptoms in me for the entire, second half of the pregnancy. So
if you're able to describe, what do you think it was like for Frank going through this? Because you said, last time with the birth, he's just focused on you. He's like, I need you to get through this because he's just, he sees you and he's like, oh my God, like she has to go through all this.
Yeah.
Was it the same or was he having his own processing and, guilt and all these things?
I think it's a good question. We should talk about it more. I think that would probably be
you and he should talk about it more?
Yeah, okay. I think that would hopefully
Frank,
probably be
here you go.
important exercise.
Schedule some time.
Ready. Yeah. My observation was that he sort of, much like he didn't want to talk to a lot of people about losing Ellie right away, he kind of threw himself into other things during our pregnancy. And I think that was healthy for him. And that was what, there wasn't much that anyone could say to me or do for me, except support me in what I ended up doing, which was going to labor and delivery all the time. Not pushing back against me on that was probably the most helpful thing, he could have done as a supportive partner. So besides that, I think he just kind of tried to keep it moving. And we were both sort of just trying to hang on until the end. He was a little more optimistic and comforted by statistics than I was. There was pretty much nothing anyone could tell me that would convince me that this was going to end well.
Yeah. That was my impression too.
Yeah.
Yeah. I think that the only wise thing that I really did was give you my email and just say, you know what, just email me.
Yeah,
like it's because I there was no, this is just who you were. Like this is it. I said, and you were appropriately not relying on my email for medical decisions. Cause you would say like, we're on our way to the hospital, just letting you know. And I was like, cool.
I was saying earlier before we started this that there was a period of time when I was like too embarrassed to email you that I was going to the hospital. Yeah. No, I'm sure not.
We email frequently, which is good. I wouldn't give it to you if you couldn't email me. Right. And so it was good for me to know that you were in the hospital a lot.
Yeah.
Also, it gives me an opportunity to let them know, to give them a heads up, like to call the labor floor, say, Katie's coming, here's a story.
Yeah,
like, just so they know, because otherwise it's, they don't know your backstory. They don't know what's going on. And they're going to be like, why, like she was just here 2 days ago. Like, what's the deal? And so to give context and, fortunately with the context, everyone in this world gets it.
Right.
But you need that context. But yeah, in addition to all the office visits, the Mount Sinai got a chance to know you well.
Yeah, they sure did. I think it must have been once a week or more during my third trimester. And it was always in the middle of it. I think there was one time that I went in the evening because I felt a movement that seemed a lot like Ellie's last movement.
Yeah.
And then nothing again. And I was 100% sure that the same thing happened again. They actually didn't find a heartbeat on the Doppler when I got to the hospital. And that, was horrible, but it was just a Doppler issue, not as soon as they put me on a monitor, everything was fine.
Yeah.
But that was a horrible day.
Did you consider the home Doppler?
So a lot of conversation about the home Doppler.
Yeah, because I was going to say that's the reason we don't like the home Doppler for that exact reason. But
exactly. So actually, I haven't even admitted this to her yet, but a friend in my support group just went ahead and mailed me her Doppler at some point during the pregnancy. and it's still sitting untouched in my closet. I couldn't bring myself to use it because I think some people use Dopplers because they want reassurance that things are okay. I was fully convinced every time I went to the hospital that things were not okay. So I didn't want to be the one to figure out that things were not okay. I wanted to hand that off to somebody else. So too hard for me to use the Doppler.
You're describing such a painful pregnancy that every day, every week, every whatever, you feel like you lost a baby again.
Yeah.
And you're
absolutely.
basically going through that trauma that you had with Ellie daily, weekly, whatever it is, for a short amount of time. That's, oh my God, you poor thing.
It was really hard. It was really hard. And I've talked about the second pregnancy as sort of its own little trauma in a way, even though it ended as happily as could possibly be.
Yeah. So let's get to that because we have to.
Yeah.
So tell me about that last week.
So this was, and I'm probably going to give you more context now than maybe you had at the time too. So, but maybe not. Maybe I shared all this. We were looking forward to a 37-week induction, 37 plus 0. It was scheduled for Wednesday, April 6th at midnight. My induction with Ellie had also been, it was for 39 weeks, but Wednesday at midnight, same deal.
Right.
And we lost her Monday morning, or that was when we found out we didn't have a heartbeat. So
for the record, I remember every single one of these details.
Okay, got
just
it.
So
Thank
you know.
I wasn't even sure.
To the minute, to the date, to the day of the week.
Got it.
Like yesterday.
Okay.
So so this is for our listeners. Yes.
Okay. So I knew that Monday before the Wednesday was going to be really hard because even though it wasn't the same gestational age, it just felt like similar circumstances.
Parallel.
So I loaded myself up with distractions. I made an appointment for a biophysical, which we had twice a week leading up to this point. And I think I scheduled one for every day so for the Monday, the Tuesday, and maybe even the Wednesday before I was admitted. And so I had a breakfast scheduled with a friend. Then I was supposed to go straight to a therapy appointment, like a well-timed therapy appointment on that day. And then my COVID test for my induction and my biophysical. So I went to the breakfast and I'm sitting at the breakfast and I'm not feeling the baby move and I'm panicking and I'm trying to say, okay, this is just the day. Like, you knew this was going to be hard. Just talk to your friend and get through it. And so I tried to distract myself. I tried to not be poking the baby every 5 seconds. I ordered an orange juice. I felt the baby move occasionally, so I knew it wasn't, the worst, but I was very, very anxious. I got in the taxi to go to my therapy appointment and I just couldn't take it anymore. So I told the taxi to turn around and go to 90th and Madison and called you guys while I was on the way and said, like, something's really wrong. I can't stand this. And I think I was standing on the corner outside your office at the time, and they said, okay, like, how soon can you be here? And I was like, well, I live right around the corner. Like, I was trying not to confess that I was already waiting outside for them to tell me to come in right now. But they basically said, you can come in right now. A very nice doctor did not one, but 2 biophysicals back to back to make sure we really hit all the criteria for a healthy baby and healthy pregnancy. Everything was okay. So I kind of took a deep breath and went to my COVID test, and I just, everything was just off. Like, I could not shake that the baby didn't feel right. I didn't feel well. Movements were really, really off. Like, I wasn't feeling any spontaneous movements. I could kind of feel him when I poked him. He would sort of poke back, but it was really, really different to where I was like, okay, I know I'm crazy and call all the time, but like, this is a real one. Like, I know that this is really different than usual. And so I went, I think I wanted to keep the original biophysical appointment I had. So I walked down the block to Mount Sinai, got my COVID test, and basically came back to the office and said, I'm just going to sit here in the waiting room until my scheduled appointment today. And they said that was totally fine. I think they thought that, what's wrong with this person who's camped out in our waiting room.
No one thought that, but yeah.
And at some point, I was just, I'm sure it was not helpful that I was just sitting there assessing fetal movement constantly, but I just was only focused on the baby and how the baby was moving. And at a certain point, I just started to cry in the waiting room. And I haven't cried. Like, I'm not a crier. I didn't cry when we found out we lost Ellie, like until I think after I held her. I didn't cry after the NT scan. I didn't cry when my husband proposed to me or during our wedding. Like that's not usually my reaction. I just kind of couldn't keep it in anymore. I was doing everything that I could do, and nothing was making me feel better or getting rid of this emergency sense that something was wrong with this baby. So a very nice receptionist kind of said, is everything okay? Like, is there anything we can do for you? And I was quickly whisked back into like an NST machine, and still everything looked fine. But you and a couple of the other doctors who were there said, look, we're talking. I mean, you will have better insight into this, but the message I got was, we just talked about it, and what do you think about going to the hospital to like start the process now instead of 2 days from now?
Yeah, basically I pulled rank. I said that's it. This is the end of the rope. I said we are. I mean, I was like, we're gonna lose you. Like, you're just gonna, you know. I mean, there's only so much one human being can handle, and you were a real trooper. Listen, I don't know if I told you this, but I, in a million years, never expected you to get to that Thursday to be induced. I was like, I thought it was almost a miracle that we got you to 36 plus weeks.
Yeah.
Because, you know, we don't want to deliver at 34 weeks. Then you're really like, you know, premature baby, this or that. So we were hoping for 37, but I was pretty confident. And especially just knowing that this concept of having a finish line and losing a baby a few days before the finish line was not going to go well.
Right.
And so when it's Monday and they're like, Katie is losing it, she's just breaking down. I was like, yeah, that seems about right. Like that timing seems perfect. And I was like, that's it. Like, what are we doing? 3 days, 2 days here? I said, like, that's it. Go to the hospital. Like, you know, because once you're there and the baby's being monitored continuously, it's like, all right, this is happening. Yeah. You know, I'm gonna have a baby. Right.
And that's like, that was what I needed, was the monitor.
Right. The alternative is that we could have literally just parked you in the hospital for 3 straight days. I said, like, well, she's not going to be able to sleep. She's not going to be able to take a shower. I said, like, that's not going to work, because if that were going to work, sending her home would also work. Right. Exactly. So I said, that's it. Like, there's just no way we can get past this. And so we're like, that's it. You know, whatever, we're inducing.
Let's do it. Which I've never been more grateful. I read, you and I exchanged emails when I was on my way in, and you were basically like, you did it. You're going to have a baby. And I was like, I don't know. Much like I couldn't process the pain of learning that we'd lost Ellie. It was really difficult for me to process the joy, but it was there.
Yeah. So how'd the labor go?
Great. I mean, another Ellie gift, as I call them, is learning about the early epidural. Yeah. So I did that again. I started the epidural before we did anything. Right. And it was good. I mean, it was like the hard part was was getting to there. And so once I could be in the hospital with a monitor on me, I mean, I was staring at the monitor every second that we were there. Yeah.
Continuous feedback.
Yep. Yeah. And by the way, like, Kai did fine during labor. There was no sign that there was actually anything wrong with him. So I don't know what that was. I mean, it was just trauma that I was feeling.
Listen, I always say is we don't know everything from everything. When stillbirths are unexplained, we assume that it's for reasons that are not going to recur, but we don't know that. I mean, like, we don't know 100%. And so part of the reason we deliver early is just, again, for, like, you know, just have pity on you, like, because it's just so painful to go. And again, in a real way, it's so painful to go through it. And part of it is because, honestly, we don't know. Like, I can't tell someone 100% that it was a fluke. I mean, I think that's what it was, but how confident do I have to be? 99%? I mean, like, that's still not perfect. And so I don't know, like, maybe there was something going on. There's no way to know, obviously. I mean, I can tell you, I know this is your birth story, but that birth was one of the best of my life. No, I mean, I was like, and I remember I saying, there's no way I'm missing this birth. There's like no chance.
I was
like,
talking, I had a doula with me for the labor, which was great.
Sure. I remember.
Yeah. And she was the best.
Yeah.
And I was talking.
That was also a good suggestion.
Yeah. Well,
she's a rock star. Yeah.
She was amazing. She was your suggestion. And she was incredible. So she and I were talking, and I think you had probably told me that for my scheduled induction date, like, oh shoot, I'm not the one who's on, I'm not going to be there, but whichever doctor is going to deliver you and you'll be fine. And so I said, okay, we'll miss you, but great.
Yeah.
And so I was
I was pretty much lying to you.
Right. Yeah. Right. So I was, at the moment you walked into the hospital room, I was having a conversation with Julie where I was like, Dr. Fox can't be here. And, I'm kind of bummed about it, but it's fine. And then in you strolled. A nice surprise. And you were kind of like, let's have a baby. And I was like, no, I'm hours away from that. And then I think you lifted the gown and said, well, there's the head. So let's get going.
Yeah. No, I remember Spiegelman was there. And I said to her, I said, you better call me in. I was like, I'm coming from anywhere. It's like, please, I invested a lot of time and effort into this pregnancy.
Right,
it's not just hard for you.
Say.
No, but it was, now that I told my story, what was that moment like? Was it a fog? Or was it clear?
It was a fog. Mm-hmm. I know Frank and I kept looking at each other and saying, like, it's so different from last time, which is like a ridiculous thing to say because, of course, in every way it was different. But it was just like the joyfulness, the noise, like the absence of sound was a very haunting part of our first delivery. But it was, it was appropriate.
Yeah. Right.
And
I'm full of sound.
Yeah. And so having, and there were teeny things with the baby we were a little bit worried about, but like your attitude was just so positive and like, this is great. The best thing happened. It's going to be fine. Enjoy this moment was what we were able to kind of live in, which was a gift. So it was, I think I pushed 1.5 times or something.
Maybe. Mine was like the easiest birth ever, like a dream come true for me.
Yeah, no, it was great. As childbirth goes, I think it was great. And we got to spend a while with Kai and eventually he was taken to the NICU because he had some mild transition issues. But honestly, for a stillbirth mom, the NICU is like the best thing. Not to minimize because obviously people are in the NICU for
you're like my kid's being watched
by
like
someone other than me for the first time. 2 years I'm monitoring babies all by my, not all by myself, but like you know what I mean.
Yeah.
So to be able to send him somewhere where they're monitoring every breath and heartbeat was fine. I was not upset about the brief NICU visit. So
amazing. So looking back now, what are your thoughts at all this?
I think what we've been through has changed me in every way. I think it's made me a more patient parent to Kai. I think it's made me more understanding of like human pain, honestly, the knowledge that everyone has a story, everyone's story is hard and deserves sort of patient support and attention. I have closer look at my mental health and mental health care than I think I've ever had before in my life. And I know how important that is as part of a medical picture too, I think, to make mental health a priority. And I think that was one of the most important parts of the treatment plan that we worked out, that, mental health was at the forefront in terms of pursuing therapy and pursuing medication, but also like allowing these reassurance visits and biophysicals and things like that just helped me to get from one milestone to the next with some kind of, I wouldn't say sanity, but functioning.
Yeah. And how's Kai doing now?
He's great. He's probably tearing up my apartment as we speak. He just learned to crawl yesterday. Wow. He's just like in every way. I know every parent says this, but in every way, the best part of our lives. And, we feel so privileged, even in the middle of the night, even during a cold or a diaper blowout, like we are so grateful in every moment that we have him and that he's here.
It's amazing. Thank you so much for telling your stories to podcasts. Really, I said it last time, it's not easy to do. And it's so valuable to me and to our listeners just to hear your thoughts on going through those 2 pregnancies and It's really helpful. And I just really appreciate you taking the time to do it. I know it's not easy.
Thank you for having me. It's healing to talk about. And, again, to debrief with your own doctor. It's a privilege. Thank you.
Thank you for listening to the Healthful Woman podcast. To learn more about our podcast, please visit our website at www.healthfulwoman.com. That's HEALTHFULWOMAN.com. If you have any questions about this podcast or any other topic you would like us to address, please feel free to email us at hw@healthfulwoman.com. Have a great day. The information discussed in Healthful Woman is intended for educational uses only and does not replace medical care from your physician. Healthful Woman is meant to expand your knowledge of women's health and does not replace ongoing care from your regular physician or gynecologist. We encourage you to speak with your doctor about specific diagnoses and treatment options for an effective treatment plan.